FraudLens is the first near real-time healthcare fraud, waste and abuse detection and prevention software solution. Our unique approach for preventing fraud, waste and abuse combines informatics, clinical expertise, forensics, information technology, and advanced data visualization. With FraudLens, it is now possible to detect the fraud early enough to transform the fight against fraud, waste and abuse from a reactive pay and chase to a proactive detect and prevent. It starts with detection. FraudLens analyzes claims every day. So you, the payer, will know every provider who has submitted a problematic claim as well as the details down to the specific patient's procedure. These findings are displayed as simple red, yellow and green bubbles, which follows nearly the universal understanding that red means bad, green means good and yellow is in between. The dashboard is the starting point. It summarizes everything that FraudLens has found in the current set of claims. At a glance, you can see the relative ratio of bad claims to good claims. To get more details about specific findings, just click the mouse and you will drill down until you reach the details of the specific patient's procedure that is flagged as problem. Once you are down to the specific patient's procedure that is problem, FraudLens generates a report. This report contains everything that FraudLens has found. The header section shows the demographic of the provider that is being analyzed. The executive summary section states that there is a problem. Presumptions and adjustment sections are added considerations that are specific to the FraudLens algorithm. Detail analysis section shows the specific procedures that are in question. The discussion section shows reasoning behind the FraudLens determination. The summary and conclusion combines all the above into simple summary. FraudLens can tell you who, what, when, where, how, and why. This report is shared with the provider and serves as the common reference document should the provider ask for the reconsideration of the claim. Now that we have flagged all the providers who have submitted problematic claims, the fraud, waste and abuse needs to be communicated immediately as part of an overall plan to effect a behavior change by the flagged provider. This is the prevent part of the detect and prevent. FraudLens achieves this through PRM or Provider Relationship Management Platform. PRM gives a central location to manage the delivery of FraudLens results to the provider. It starts with the dashboard, which summarizes the FraudLens findings and allows the user to drill down to see specific details. The email feature contains the entire history of the email alerts that are sent to the provider. This includes all the automatically generated and sent emails as well as those that are manually composed and sent. Also, we keep a track of all the emails that are opened or unopened in our system. The Watch Behavior feature shows a timeline of claims. The user can see if there has been any change over the time. If a provider changes from red to green, that is an evidence that provider has exhibited behavior change and stopped submitting the problematic claims. Alternatively, a timeline that shows a change from green to red suggests that the provider is now starting to submit problematic claims. The Tracking Response feature tracks specific escalation and de-escalation events for all the providers. The up escalator icon is red and the down escalator is green. If a provider reaches the highest level, this is the icon that appears. FraudLens capabilities not only detects the fraud but also helps to visualize the good guys. The green providers give you insight into what your network is doing right and it serves as a benchmark for the future improvement. Our strong communication with the providers help to prevent the future frauds. FraudLens benefits your entire organization from the C-suite to the people responsible for the execution. You can download the infographics from our website. Thank you.